Hello everyone, welcome back to my channel Connect Radiology. So this is Dr. Durga practicing diagnostic radiology with passion of teaching. So let's start. So I'm starting a new series of approach, okay, very useful for the exam going residents, the approach series, okay. So in today's video, it's all about approach to spinal tumors, okay. So I'll discuss the theory part and the clues for diagnosis in first part of this video, and in the second part of this video I'll be discussing, in fact we will look for some few real cases, okay. So let's start with the approach to spinal tumor. So whenever you are given a case of spinal tumor, your very first step is to compartmentalize that tumor. Which compartment the tumor belongs to. You have to compartmentalize the spinal tumor. Once you know the compartment, okay, you should know about the differentials of tumors of that compartment, okay. There are very few differentials of each of the spinal compartment. So in your mind, the differential should be there, which tumors occur in these compartment. And once you have thought about the differentials, you have to diagnose actually what tumor it is by characterizing it, okay. So you have to compartmentalize, you have to think about the differentials of tumors of that compartment, and then you have to finally segregate by characterizing that tumor, that finally which tumor it is, okay. So let's start this video by the very first step, that is compartmentalizing the pathology. In the spine there are basically three compartments, okay. Now let's know about the compartments of spinal cord. So this is actually the spinal cord itself, which is covered by the meninges. The outermost is the dura, then the arachnoid, and along the surface of the spinal cord is the pia mater. What is outside this dura is epidura, is epidural space, okay. This neural phenomena all are included in the epidural space. This subarachnoid space beneath the arachnoid layer is actually filled with CSF. What lies outside the dura is the epidural space. What lies inside the dura is the intradural things, okay. And when cord itself is involved, this is intramedullary. So by this there are three compartments of spinal tumors. So in this diagram, this is actually the dura mater, this is the spinal cord, and between the dura and the spinal cord is this CSF space. With this, let's now understand the spinal tumors. So whenever the spinal cord itself is involved, it is intramedullary, and obviously it will be intradural. So it is intradural intramedullary tumor. The spinal cord itself is involved. The spinal cord will actually expand. There will be expansion because of this tumor, because of the edema, and see, as the cord expands, there will be obliteration of the CSF space along the tumor margins. There is no CSF space along this margins, okay. Now, whenever the tumor is intradural but extramedullary, means the tumor is somewhere lying here. So this tumor is intradural definitely, but extramedullary. It is causing extrinsic compression over the spinal cord, and it may cause like lateral displacement of the spinal cord, like deviation. And as you all can see, there is this subarachnoid space is actually widened. See, there is widening of the subarachnoid space. And the third type of tumor is actually epidural tumors. So extradural or the epidural. This is coming from outside, okay. So see, this is like this, okay. This is causing compression over the dura also and spinal cord, and the CSF will be like here, the CSF space is actually obliterated. So now I think you can differentiate, like this is the intramedullary, obviously intradural, causing expansion of the tumor, expansion of the spinal cord, and the subarachnoid space is actually obliterated at the site of the tumor, as the cord has some convex outward bulge. Next is the intradural but extramedullary. So it is causing like mass effect over the spinal cord, causing its lateral displacement, but as the tumor is within this dura, so there is this widening of the subarachnoid space at the tumor margins. And the last is the extradural, so it causes compression over the dura and the cord, and see, there is obliteration of the subarachnoid space at the tumor margins. So the things that are important are, look at the spinal cord, its expansion, its deviation, look at the widening or the obliteration of the subarachnoid space at the tumor margins, and look for the like shift of dura mater also, okay. So these are the three categories of spinal tumors, okay. So now let's look at one example also. So this is involving the spinal cord, so this is intramedullary. So now see this tumor, this is within the dura but outside the spinal cord, so this is intradural extramedullary. Whatever outside this dura mater is epidural, like involving the vertebral body within the epidural space or along the neural phenomena. So all these are extradural tumors. Once we know the compartment, whether which type of tumor, from which compartment it is arising. Now we can think of the differentials, like what tumors basically arise from these compartments. Okay, so for the exam point of view, amongst the intradural intramedullary tumors, important ones are ependymoma, astrocytoma, hemangioblastoma. Okay, so these three are the important ones. Okay, ependymoma, astrocytoma, hemangioblastoma. In part 2, obviously we will discuss in bit details. So these are the intradural intramedullary. Next is intradural but extramedullary. Among these, the most common two for exam point of view are the meningioma and the nerve sheath tumors. Okay, next one is the epidural tumors, and amongst the epidural tumors, the most common ones are the metastasis. Okay, and in this epidural group of tumors, all the bone tumors, all the tumors involving the vertebral bodies will be there, and there can be like epidural lipomatosis, hemangiomas and all. But from exam point of view, these two categories are very important, like the intradural intramedullary and the intradural extramedullary tumors. So these are the differentials. Like whenever you are suspecting a tumor from intramedullary, then you have to think about the differentials, like whether it can be ependymoma, astrocytoma, hemangioblastoma, and so on and so forth. So the last step is actually characterizing that pathology by looking at the patient demographics, like female, male, age. Okay, the clinical features with which the patient presented, and the specific imaging features. Okay, so like for ependymoma, as per the name, it is arising from the ependymal lining, so this will be a central lesion, and these are very like homogeneously enhancing, okay, with intra or peritumoral cysts. So these are the characteristics, like there will be central lesion along the spinal canal, then homogeneous enhancement, and with peritumoral cyst and all. The in detail characteristics we will discuss in part 2. Next is the astrocytoma, very common for pediatric age group. Okay, and these are very ill-defined and sort of heterogeneous enhancement, and usually like they are long segment, they involve long segment of the cord, and they will be eccentric. So pediatric age group, eccentric lesion, and also there are cysts also, and hollow cord involvement is very common. Next in the intradural intramedullary group is the hemangioblastoma. As we all know, hemangioblastoma are famous for avid enhancement. Okay, and they can be associated with a cyst and a mural nodule. Whenever the solid component is there, it will avidly enhance with the associated with cyst, or it may be without cyst also, and as it has abundant vascularity, there will be fluids. Okay, and one more very specific feature for hemangioblastoma, whenever you find extensive syrinx formation, okay, you can think of hemangioblastoma. Next, these three I have discussed the basic for exam purpose of point of view, the basic three intradural intramedullary tumors. Amongst the intradural extramedullary, meningioma and schwannoma. For meningioma, middle-aged female, ovid enhancement, dural tail sign. Okay, and for the nerve sheath tumor, like as we all know, dumbbell shaped tumor, like it will be passing through the neural foramina, and sort of some mild enhancement with cystic changes within it. Okay, so these are the meningioma and nerve sheath tumors. So these 5 tumors are basically asked in exam. Apart from these, also there can be cases. We will discuss that in part 2. One thing left is actually these are for the whenever there is spinal cord, but when the cord ends, like the chordae coina and the phylum terminale, what tumors arise from there? The basic differentials you should keep in mind: the myxopapillary ependymoma, the nerve sheath tumors, spinal paraganglioma. Okay, in the chordae coina and phylum terminale region, these 3 tumors are basically asked. So for the myxopapillary ependymoma, the tumor will be lobulated and sausage shaped, enhancing lesion at the like conus or the chordae coina or the phylum terminale. So these are the 3 steps of characterizing the spinal tumor. First, compartmentalize it. Second, think of differentials in your mind. Third, characterize and tell this is the case. Okay, so now let's see you all in the second part.